Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Equipoise. This audio podcast as part of a lap storm motley. This audio podcast as part of a storm and scuttle and turbulence. This audio podcast as part of the Squakish Series and or edition, and this audio podcast as part of a Storm Robotics production. Through this audio podcast, I look at sort of renal in around renal and nursing or nursing aspects in around nursing or nursing practices. So nursing practice in around nursing practice to begin is where practice aims to optimize patient care through improved through for example improved comms or communication and through a sort of a systematic approach or in around sort of the barriers and hindrances to hindrances to care and healthcare, and also in around developing strategies to address sort of those barriers. The nursing sort of model in around renal or kidney in around kidney care had developed to encourage and support in around self management amongst a renal around amongst the renal population, and then additionally different models of care allow or have allowed to identify specific hindrances or barriers to quality patient care, and how these might be how these might be or can be impacted. Structures set up to expectation and means of integration between the points of care, different points of care for recipients in around the early stages of CKD, and through in amongst in amongst and through in amongst and through different forms of RRT or KRT, for example, is and where, for example, when nursing practices have sort of have sort of advanced and enhanced in sort of over over several decades, and different models of provide and sort of offer recipients a sort of a great sort of in around a greater sort of a sense of signposting, a greater sort of sense of signposting, and around aspects pertaining to in around renal services and healthcare services, to prompt ultimately sort of a sense of efficiency, where, for example, clinicians and specialists, for example, can often fall short. In amongst nephrology, the care of CKD recipients is and can be complex or has complexities, and often requires sort of assess excuse me can often require sort of continual assessment in around this sort of in around the excuse me in around in around the sort of clinical healthcare sort of syndromes and planning and in amongst aspects pertaining to the underlying aspects of patient education in around and amongst different 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 sort of and again aligned to different different sort of etiologies of where CKD is concerned. Nephrology nurses sort of tend to take part in around at the at sort of at early stages of CKD, but also additionally and around throughout ESKD or ESRD, whereby ultimately in around sort of in around sort of where where nursing professionals also have sort of in amongst more recent sort of CKD or healthcare services look to alleviate some of the burden around sort of the sort of nephrology specialists in amongst some of the some of the traditional healthcare services that specialists have and may have, for example, depending on where, for example, may for example no longer be involved in some of those traditional or sort of historical kidney care or nephrology services. So nurses or nurse professionals, for example, thus take on take on some of the healthcare services, thus to alleviate some of the clinical aspects of the specialty. This includes a sort of a labor sort of intensive healthcare services, and also in around the coordination of healthcare in amongst sort of clinical practices. So leading on, the healthcare services by and through nursing healthcare practitioners or nursing healthcare service providers. Some of the clinical practices also sort of include sort of CKD, chronic kidney disease clinics, anemia clinics, vascular access clinics, renal replacement therapy initiation, and diagnoses and evaluation in and again depending on where, for example, and nurses manage sort of clinics to ensure that patients' needs are met. And then in addition, in sort of a look at sort of the promotion of self-management. So promotion of disease and self-management. Promotion of condition or disease and self-management is and tends to be an important underlying principle in the care of any recipient with the chronic condition or in around the renal illness. Patient education is crucial to all patients' understanding of diagnosis excuse me, of diagnosis and treatment options, and publications have formed sort of variances in around excuse me, and around the sort of patient education aspects. Patients should develop a sort of broad understanding of managing sort of in around the symptoms or symptomologies and in around the pharmacotherapeutics. The earlier patient education occurs, for example, there is evidence to inform the greater the opportunity for slowing or precluding the progression of renal symptomologies, and making informed healthcare decisions. The goal of patient self-management additionally is where there's maximum patient participation, then allows sort of then allows or encourages self assessment, monitoring as monitoring aspects, then in around or additionally around pharmacotherapeutics, where healthcare service users gain or attain a sense around the aspects in around pharmacotherapeutics, and then in around also around treatment different excuse me, in around different treatment administration or administrations, evaluation of therapies or different therapies, physical and psychological or wellness sort of health or healthcare promotion, prevention or prevention or precluding of complications, and improved adherence to different sort of pharmacotherapeutics. Additionally, in around some of the excuse me, in around some of the barriers or hindrances to patient care, there can be challenges where recipients or healthcare service users can have vascular access abnormalities. There can be inadequate preparation for different forms of KRT or RRT. There can be a lack of integration practices in amongst nephrology in amongst nephrology or the specialism, depending on where nephrology practices are, and there can be delays in requests for a nephrology or renal consultations. There can be unnecessary hospital admissions, and inappropriate utilization of in around emergency services, and there can be inefficient discharge planning and poor communication with outside healthcare service providers. So in around sort of removing some of the barriers to care, a nurse practitioner therefore functions as apart from a healthcare service lead. Uh, a nurse a practitioner also functions as a liaison, a sort of a liaison between healthcare services and the additionally in amongst the inpatient dialysis unit, or in or on-site dialysis on-site dialysis or KRT or RT unit, and in amongst the outpatient dialysis environ. A nurse practitioner at the same time is a lead that tends to communicate within healthcare services, as a way to foster a prompt more integrated communication between different healthcare service providers, and in around adult and pediatric or young people healthcare, renal and nephrology services. A transplant nurses, for example, visit tend to visit in to assist with the continuity of care between outpatient settings and inpatient settings, And so now looking at the in around sort of finally in around excuse me, finally and around sort of the patient education aspect. So as patients become more autonomous, so more autonomous being both in between pediatric young people services and in amongst adult healthcare renal services, they become actively involved in decisions regarding healthcare. Patients who become sort of experts or have expertise in managing sort of medical or clinical conditions are more able to preserve sort of the sort of social roles and and where this also where this wherein where that sort of expertise also can prompt a sort of a sense of self-esteem and in around the and also where excuse me, and wherein also there's literature, and where literature informs that the repertoire between different healthcare professionals, nurses and clinicians and others, for example, and patients, the relationship can also actually where the healthcare where the relationship actually develops into a more of a collaborative relationship between patients or recipients and healthcare service providers, unlike sort of where in traditional healthcare services is where healthcare providers generally have had sort of a sort of a top sort of a top or hierarchical sort of a demeanor or default. And so CKD patients or recipients must at the same time have a sense of transparency or understanding of all elements of in around the condition and symptomologies in such a way that this then prompts autonomy and a sense of independency. That draws this audio podcast to a close. This audio podcast as part of the Equipoise. This audio podcast as part of a Labstorm Motley. This audio podcast as part of a Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish Series or edition. And this audio podcast as part of a Storm Robotics production.